Describe a day in your life in AIIMS, today in Apollo, typical Sunday for you.
I think that's a very difficult question though.
What is your salary? I was your student for 6 years. आपने जो अचीव किया है वो हम सब सपने देखते हैं.
You trained with me and then you went to Germany and then you honed your skills, learnt more things. I believe that your children and your students, they must do better than you.
According to me, your biggest achievement is जब आपको president से award मिला था. What is the biggest achievement according to you?
This was the first time ever in the world that this kind of surgery was done.
Do you feel a difference when you operate on a VIP person or a random common man?
Sometimes the VIP treatment is compromised when you have to perform your duty as a doctor. You have to be totally detached in the sense that if it requires to amputate his leg to save his life, I'll
You
not
have
for
to
a
do
minute
it, yes.
think that whose leg it is.
What if something goes wrong?
Ask for help.
कोविड टीम को लीड करने का कैसा था एक्सपीरियंस?
So that had a lot of challenges. The class 4 employees, they resigned and went. All that manpower was gone. You can't fight these battles sitting in your air-conditioned offices.
एट द एंड ऑफ द डे एम्स इज ऑल्सो अ गवर्नमेंट हॉस्पिटल. तो उनमें भी था सर वो सरकारी कर्मचारी एटीट्यूड.
I think that's the beginning of the end. Monk who sold his Ferraris is
हेलो एवरीवन, वेलकम टू डेली डॉक्स, जहां वाइट कोट सिर्फ कहानी की शुरुआत है. आज हमारे साथ हैं बहुत ही डिस्टिंग्विश्ड गेस्ट, वर्ल्ड रेनाउंड ऑर्थोपेडिक सर्जन एंड प्राइड ऑफ इंडिया. जितनी मेरी उम्र है उससे ज़्यादा सर ने एम्स दिल्ली में काम किया है. सर के मुंह से निकली एक भी लाइन हम सब लोगों के लिए वो गाइडलाइन बन जाती है. सर रिटायर्ड एज हेड ऑफ द डिपार्टमेंट ऑफ एम्स दिल्ली, चीफ ऑफ ट्रॉमा सेंटर, एपेक्स ट्रॉमा सेंटर, एम्स का जो ट्रॉमा सेंटर है. Sir was the president of Indian Orthopaedic Association, Delhi Orthopaedic Association, multiple awards winners. Sir is also the member of biggest and elitist societies of the world, chairperson of Asia Pacific Society for Osteoporosis, multiple world records. Sir, first Indian to do computer assisted surgeries, knee replacements and hip replacements. Welcome Professor Dr. Rajesh Malhotra. Thank you sir for coming.
Thank you for having me.
सर मेरा पहला क्वेश्चन तो आपसे होगा सर, अकॉर्डिंग टू मी योर बिगेस्ट अचीवमेंट इज जब आपको प्रेसिडेंट से आप अवार्ड मिला था. बट व्हाट इज द बिगेस्ट अचीवमेंट अकॉर्डिंग टू यू?
So my biggest achievement has been doing the surgeries for the patients where everybody gave up. So they have been my biggest achievement, and by the grace of God, I have a few of them. But I think the biggest satisfaction is not just recognition. It is just doing the best way what you are good at. This is like they say, this is what we do, this is what we are. So whatever I do, when I'm able to do it to my utmost satisfaction, like operating on cases where everybody has given up, that gives me the highest satisfaction.
सर ऐसा कोई एग्जाम्पल याद आ रहा है?
बिल्कुल याद आ रहा है. और वी हैड दिस यंग लेडी हु हैड rheumatoid arthritis, and she had a knee replacement and hip replacement, and she had a fracture in between the hip replacement and knee replacement, and everybody said that she needs only total femoral replacement, and we could actually use bone from the bone bank, and we made her walk with her own bone rather than the metallic artificial total femoral replacement. Similarly, one of the biggest achievement was when close to 9 years back, there was this gentleman who was bedridden for more than 10 years, a librarian from Odisha, and he came with multiple deformities, and we did 4 joint replacement in the same sitting, both hips and both knees, and we made him stand and walk the very next day. Of course, that had a contribution from my anesthetist, my team, everything. But this was the first time ever in the world that this kind of surgery was done. So I think that is one moment I remember as the most defining moment of my life, where we put all our knowledge and experience of doing joint replacement for all these years with my anesthetist friends to overcome a challenge which would not have been possible to do in stages. We know that these things don't work out as well done in stages.
ये तो सर शायद अखबार में भी कवर हुआ था, आई रिमेम्बर एज अ स्टूडेंट
Yes,
हमने पढ़ा
and
था.
yeah, this was covered by Ridhma Kaul in Hindustan Times, but then we published it also.
Great.
And then we could repeat this feat 6 more times,
Wow.
but we are very, very selective about what we do. But that is the kind of challenge we faced and we overcame.
सर एज अ ऑर्थोपेडिक स्टूडेंट पहले कौन सा जॉइंट किया हिप और नी में?
So the rule is that when you are doing hips and knees, both are involved. You should first do the hips and then do the knees.
Right.
So we did 2 hips, and then we did both knees as 2 teams because to cut down the surgical time.
Wow.
And today I would have done it differently, but that
Okay.
time we did it by posterior approach. So we took more time because we did one side, then we turned him around and did the other side.
Now you
So the
would do it with the
now we would do it by direct anterior
Right.
approach in supine position,
Right.
and do both hips with 2 teams. Do it in one go, and then both knees in one go. See, it's all about team building. So nothing is achieved in isolation. So that team, when you are junior, you are a part of the team where your seniors, guide you and mentor you. And when you become senior, then you have a team which comprises of people who work with you. So at all times, you are a part of the team. If you have to do really good quality work and you have to excel, you have to be a team player, and you have to have a team where there is such rhythm and sync between the members that everything flows effortlessly. I'll give you an example. My mentor, Dr. David Morgan, from whom I learnt bone banking in Australia, in Queensland Bone Bank, good 26 years back. He used to say that I should not have to ask for any instrument on the table. So my team should know that which instrument I want, and that is
Right.
key to efficiency also.
Right,
That's
makes
key
sense.
to doing many cases in one day. That's key to doing surgery fast, and that is the onus is also on the surgeon, that every time he should operate through the same steps. So if I operate every case differently, then my team will never know what is the next step.
Right.
But it's all about, playing together as a team, the cohesiveness, the understanding, and everybody striving for the victory together. And victory in this case is sending the patient home recovered
Walking.
and healthy and happy.
Yes, sir. Happy. Sir, what is the biggest achievement according to your wife?
So, so according to my wife, I think that's a very difficult question. The wives are difficult to predict. But then I think when I became the chief of trauma center, I think that's one thing which both my wife and my mother were both excited about, because that was something which was really, they thought, something which I love doing and where I could do a lot.
Sir, I was your student for 6 years. Now indirectly also your student. But मेरा एक हमेशा से ये क्वेश्चन रहा है मन में, हाउ डज इट फील टू बी ऑन टॉप? लाइक यू आर एट द टॉप ऑफ एवरीथिंग. आपने जो अचीव किया है वो हम सब सपने देखते हैं कि शायद कभी करेंगे. अब आपने कर लिया, यू हैव डन दैट, बीन देयर, डस्टेड, you have retired from such high positions, and now also you are leading a team in one of the largest leading centers, Apollo Hospital. So अब कैसा लगता है sir?
So it is said it's very lonely at the top, but I don't
Exactly.
agree with that. I think when you are at top, you have to see how many of your proteges, your students, you can pull up to the same level. In fact, not only pull up to the same level. I believe that your children and your students, they must do better than you. That's what everybody wants. A father wants his children to do better than him. A teacher wants his students to do better than him. The reason is very simple. If my students can't achieve what I have done, and their students can't achieve what they have achieved, and so on, there'll be attrition of the talent. Now,
Right.
my students, like for example, you trained with me, and then you went to Germany, and then you, honed your skills, learnt more things. When you came back, I was always keen to learn what you learned from Germany, so that I can improve my practice. So one is, education never stops,
Right.
learning never stops, and it's got nothing to do with age and seniority. So I think when you are at top, you have to set the bar higher. That's number one. So you should never rest on your laurels. So see, nobody is perfect, and the moment you start thinking and saying that you are the best, I think that's the beginning of the end. I think what you need to do is, you have to still see where we can improve. And it said, the more faults you can find in your own work, the closer you are to perfection. So it's not enough to give 99% just because nobody else can give 99%. You have to go for 100%, and there's always room for improvement. So I think that's what you have to do. Not think that you are Muhammad Ali the greatest. You have to think you are someone who still has so much to improve, to achieve more, and also pull your team along, because when I hang my gloves, I want to leave a legacy which achieves much more than what I have been able to do in my life. I'll give you an example. I learned bone banking. I did a 1 year fellowship, and I brought that technology to India. So I was so excited. When my students started seeing bone banking, uh, I did a 1 year fellowship in Australia. When my students, I sent them, the first few went and they came back in 6 months and they said, "Sir, we already
New.
knew." So it was nothing exciting. For me,
Right.
it was an exciting thing to be introduced to a new technology which was not available in India. The cadaveric bone banking was not done. So I did 1 year fellowship. When I sent my students, they came back after 6 months saying, "Sir, 6 months was enough because we already see these things here every day." And then subsequently, some of them even turned down the opportunity,
अच्छा.
saying that we are
आ तो
quite
गया ही
good,
है.
yeah, and then we know. So
Right.
so I think this is the message here, is that I had to spend 1 year there because I was learning something new. But then I have to fulfill my duty in order. If everybody from India has to go and spend 1 year again there to learn,
Right.
now they had this thing in house where they could actually learn here, and then they can concentrate on learning other things which are not available in India.
Makes sense. अच्छा सर, I have also seen you perform or treat many VIPs. और मतलब कुछ तो बहुत ही बड़े VIPs. तो आपको like do you feel a difference when you operate on a VIP person or a random common man?
No, I don't feel the difference because I think that's how it should be. That's what our scriptures also tell us. When a patient is on the table, it's regardless of his status, regardless of his, the socioeconomic condition. It's just a problem which has to be addressed and something which has to be treated. Uh, you can't let this weigh heavily
Exactly.
on your mind, because that will compromise your performance. So what I'm saying is, I take a history from a VIP as I take from any other patient. And I once commented to a very senior person. I said, "Sir, I think sometimes the VIP treatment is compromised because the doctor is scared of telling them the right opinion or the right word." And in Ramayana, it's written, "Sachiv Vaid Guru Teen Jo Pri Bole Bhai Aas Raj Dharam Tan Teen Ka Hoye Begehi Na." So if your advisor, your guru, and your doctor, Vaid, tells you something or conceals something so that you may not get offended, it will compromise your health, it will compromise your character, and it will compromise your kingdom. So if you have to tell someone to lose weight, you have to tell them to lose weight. And
Right.
similarly, when they're on table, uh, getting overawed by what a person is not going to help the cause and interest of that person. So no, and for the same reason, I operated on my mama, I operated on my mother, because
Family.
I was not as confident about anybody else operating as I was. Now, you may question the ethical angle, but I was pretty happy doing it because I thought I wanted to do it the best way that it could be done. And sometimes it's uncomfortable if you. It's all right when it's some other person's speciality or some other
Hmm.
speciality, but when it is your own speciality, you have to make sure that if it is somebody very close to you, somebody better than you has to operate. And I have
Right.
never hesitated from it. If I am operating on even in a common man, and it's a surgery which I don't very often do, but to respect his wish that I should operate on him, I get a colleague who's more experienced on doing it, though I have more experience in the field. But just because I have not sort of been doing that surgery very frequently, I'll have no hesitation in getting him along. And still, once in a while, I can give him a tip about a surgery which can
एग्जैक्टली
help him.
दैट्स वेरी ट्रू सर एक ऑर्थोपेडिक सर्जन की तरफ से मेरे मतलब मेरा ये क्वेश्चन है अभी तो आपने कर ली 50,000 सर्जरीज और मे बी इवन मोर बट द फर्स्ट टाइम यू डिड अ लाइव सर्जरी इन फ्रंट ऑफ थाउजेंड्स ऑफ स्टूडेंट्स यू हैव बीन डूइंग इट फॉर मैनी ईयर्स सिंस आई नो बट फॉर द फर्स्ट टाइम तब भी प्रेशर फील नहीं हुआ लाइव सर्जरी
No, there is no pressure, Naman, because simply because we do it every day in the theater. So the thing is, how does it matter whether you are explaining the steps to 4 people or 3 people on the table who are your assistants, or to 1,000 people who are in the audience? See, the thing is, one, you should be good in your job. Two, you should feel confident that you have the necessary skill set to educate people about it. Three, never underestimate anyone. The students are very sharp, they are very
एग्जैक्टली
observant. You have to be in total control, whether you are giving a talk or you are giving doing a demonstration surgery. They should not feel as if you are underconfident. If that happens, it means either you don't know your job or you haven't prepared it well. So every case which I do even today, I go through every small detail, and sometimes I get up in the night thinking that maybe we should arrange a particular thing in addition for the tomorrow's case. So I think that's because if you want to do something, it's almost something like what Vivekanand said. You should just get yourself completely involved in that. That means try to run every step in your mind. It's just like writing an exam. You think about what all can be asked in the exam, so you prepare accordingly. And I tell you, these are great teaching experiences. Giving a talk and facing questions, doing a surgery, a live surgery or a re-live surgery, but answering questions because people want to know why you are doing a particular step, how you are doing. They are observing, and they are also answering a question. But I think the biggest responsibility on you is they should go back from that teaching experience enriched and not
यस
confused,
यस
because it's a great responsibility. The people you are training today, they will be operating independently on the patients, and they are operating on the citizens of our country. So I had this thing about many institutions, including my own. They said, we will not train people from private practice. So whatever the reason may be. But what I think is, as a teacher, how can I deny training the private practitioners? Because if they mess up a thing, the patient will come to us only, and
एग्जैक्टली
that will actually also consume our resources. So I think as teachers, we have to train each and every person who's practicing in this country so that they give better results and reduce their complications. So
राइट
the education can have no bars. Now, sometimes the apprehension is the misusing the thing. It's all kind of apprehension. But I think at the end of it, it's very important that people who want to learn, who are keen to learn, should be presented with the opportunities where they can improve themselves. We can find out ways to do that.
सर अब थोड़ा सा चेंज करते हुए आई वांट टू आस्क यू सम क्वेश्चंस about your job as an administrator. You have been at the top positions as chief. So कभी सर आप पे भी प्रेशर बना होगा. How did you tackle pressure from above?
So that was very common. I'll give you an example. Every now and then, somebody would like to shift a patient or of head injury who was operated somewhere else and now is on ventilator. Family cannot afford money and they want to shift to trauma center. The problem is, I understand their dilemma, but the problem is it's a big ethical question. If you have a patient who primarily was treated with somebody else and who's on ventilator, and you want to shift to a level 1 center to save cost, compared to a young person who has come to my ED, and if he's not admitted, he will die. That
Right.
patient always has to have a priority. That's number one. Number two is, if you just open the floodgates for everyone, you'll, even if you make 1,000-bed hospital only for people on ventilator, it get filled in no time. So that's the problem. It's triaging. So the triaging is not only of the patients. We have this concept of triage where we say green, yellow, and red. Green, even if you don't do anything, nothing is going to happen. The yellow are ones where if you do something, they can be saved. If you don't, they'll die. And the red ones are resource intensive, manpower intensive. 5 people may have to work very hard and you may still not be able to save that person. So where does the buck lie? The bang for the buck is the yellow people, because people you can save where less manpower can get you more result. So similarly, in a resource constrained setting, you have got no option except to try and do as much good to as many people with limited resources as you can. And that can happen only if you learn to say no. That's the most difficult thing in life, is to say no. And frankly, it's not always 100% it's possible to say no. But then if you are saying no, you must reason it out with the person you are declining, just to say what your limitations are, and that it is not anything personal. So that is, of course, how it is. Similarly, you would get a lot of pressure, for selection of a particular candidate.
Exactly.
Now,
सिफारिश.
if I have spent, say, 44 years in an institution, so whose responsibility it is to make sure that the best candidates are taken in, because that's all will maintain the standards of the institution. But sometimes you see all these rules being violated and you feel very sad. But the fact is, it is injustice to the most deserving candidate, and it's also injustice to the institution. Because an institution which thrives on talent and hard work and commitment, sincerity and brilliance, you can't just keep on diluting the standard, because then it can only go downhill.
सर टॉकिंग ऑफ स्टैंडर्ड्स सर, जो आपके सबॉर्डिनेट्स थे, अब एट द एंड ऑफ द डे एम्स इज़ ऑल्सो अ गवर्नमेंट हॉस्पिटल, तो उनमें भी था सर वो सरकारी कर्मचारी एटीट्यूड, और आपको यू हैव टू रियली पुश देम, या कैसे हैंडल किया सर?
So that is very interesting. I think there are 2 or 3 ways to do it. One is that, you have a group of 10 people. Nobody is doing research. Everybody is happy.
Yes.
The moment one guy does research, the
Yeah.
others feel the pressure. And I think that's the key thing about AIIMS
Okay.
or any other good institution. That's some kind of peer pressure.
Right.
And you can call it healthy competition, you can call it peer pressure. But what happens is, if a guy who's your contemporary publishes 3 papers, you feel constrained. So that's how I always say that institute is a place jahan pe gadhe bhi aake ghode ban jate hain. That's because it doesn't matter. But only thing is that, you at least to have some horses on board. But otherwise, this place It allows you to grow. It doesn't stop you from working. You can work as much as you like. So that is an ideal environment which is conducive to growth. So always remember, when you are in charge, you have to make sure that everybody not only feels involved and everybody not only works together, but they themselves should also have growth. So you have to make sure that your team members, you should have, they not only they should have a vision for what they will be after 5 years.
Hmm.
You as an administrator or a teacher or a leader also have to think where you want your team members to be 5 years from now.
राइट सर, कोविड टीम को लीड करने का कैसा था एक्सपीरियंस?
So it was just, we fell into my lap because we had actually made a new ICU on the ground floor, which was not yet commissioned. And the thought came to our director's mind that we can use that area for screening. So you can just hold patient there with the what was being called there, that upper respiratory symptoms, to know whether they are suffering from COVID or not. And from there, suddenly it was decided that why not to make a trauma center as the COVID hospital. So that had a lot of challenges. We had about 50 patients on ventilator, and one of them was a 200 kg man on a ventilator. And all those patients, he had a head injury, and all those patients had to be shifted to the main hospital after creating beds there. And then the whole lot of structural changes in the trauma center, which was started even as the part of the vacation and shifting of patients was being done. And but that was something really challenging, because I remember in the class 4 employees, they resigned and went. They
Okay.
wouldn't come, they were so scared. And then interestingly, I realized that uh, trauma center staff and the NDMC Charak Palika hospital staff and all these hospitals which had class 4 employees, they were all living in a colony in Sangam Vihar.
अच्छा.
And then the COVID broke out there. So
हाँ.
suddenly all that manpower was gone for the days that they were all affected by
Oh.
COVID. And then some of these class 4 employees, they would not tolerate the PPE, they would vomit in the wards. And the apprehension, nurses were apprehensive. They thought if we go home, our family will get infected. People didn't want to go home. So this was, and then it was very difficult to work in PP. So my rule is, you can't fight these battles sitting in your air conditioned offices. So I would take twice a week, I would wear PP and take around, almost sometimes extending to 8 hours, when I was looking after the burn and plastic as well as the trauma center, both of which were at that time converted to COVID hospital. And that was when the people were actually reluctant to do a 6 hours duty in PP. And so the advantage of this was, one, nobody ever told me you don't know what it is like to work in PP,
Right.
because I would be in PP and I'll go and take rounds. Two, the medical superintendent, the nursing superintendent, the sanitary inspector, the physiotherapist, the dietitian, the electrician, the cable man, they'll all go for the round with me. So I would say that the cable has to run in the ward, because hey, somebody whose only connection with the outside world is a television. So we can't have leaking taps in the ward. So they have to be fixed. Bad, broken down.
ग्राउंड लेवल से ऊपर तक सारा
Yeah,
काम करना पड़ा.
and then there would be complaints about quality of the PPE. So when I would go, they'll say, Chief has come, let's give him the best 3M PPE. I'll say, no, give me the worst one you have, the one about which we have most complaints. So I was never caught unaware if somebody would say that the soap is not good, the shoe is not good, this thing is not good. So this actually is the entire philosophy, because no team member should feel that I am being subjected to risks by a person who is sitting in his office and trying to guide me from outside what to do.
सर कभी ever you felt helpless, like अब क्या करूँ मैं?
Of course, I have felt helpless many times. At the time of COVID, we had an administrative officer in faculty cell, and went out of he went into coma. He was in on ventilator. He recovered. I went to see him and I said, you are doing very well, you are a fighter, and we'll get you out of ICU very soon. And the evening suddenly he deteriorated and died, and this happened to a lot of people. And then felt helpless when the system couldn't take care of things like misplaced phones, which was not
Oh yes.
like I would say thefts, but everybody was so scared of handling anything that some of these phones were, sent in the trash because the person was in ward. Suddenly he became sick. So he was shifted to ICU because it was urgent, but there was nobody to take care. So we made protocols for that. We would seal the belongings in an envelope and hand over to security and give. We were successful in most cases, but there were still problems because of the very nature that people's judgment was clouded. They were anxious, and they were fighting a disease which they didn't know anything about.
सर little questions about your personal life. इतनी सारी चीज़ों में how do you maintain this work life balance?
So I think work-life balance is a great concept, but something which has eluded me all my life, because somehow the problem with being obsessed with your work or trying to be a perfectionist is that you cannot have much of a personal life. I'm not glorifying it. There's a tendency to glorify overwork in India. It's not about that, but it's, I think, your own nature. Because the problem with our profession is that we are dealing with human beings, where a smallest of the mistake can cost a life or limb to a patient. Now, that is something which is, it's something which is, it depends on you how seriously you take it. And I was once on a Doordarshan program, and I had this very smart compare, and she asked me, how do you bond with your patient? So I said, you have to have empathy for them. You have to understand what they are going through, but you can't start suffering with them. Because if I suffer with their pain, how will I treat them? So she said something very nice, and it's written in Gita also. So she said it's like attachment with detachment.
Okay.
So it's like you are, you have all the concern for the patient, but when you have to perform your duty as a doctor, you have to be totally detached, in the sense that if it requires to amputate his leg to save his life, I'll
You
not
have
for
to
a
do
minute
it. Yes.
think that whose leg it is and whether I should be amputating it or not. There, it is something which has to be done, because otherwise the person will die. So there's often saying that people say that those who are very good doctors don't have good family life, and because they work too hard in the hospitals and all. Then somebody else said, no, it's not like that. Those who don't have good family life, they become good doctors because they don't want to be staying at home and they want to work in the
Right.
hospital. But I think both those statements are wrong. But it does matter how your family takes it. So you are able to, nobody is able to achieve professionally what they have unless they have a supporting family. So if your family supports you, I think it becomes very easy. The work life balance becomes a major challenge if you say spend 18 hours in the hospital because you had a long OT day and it was challenging, and you come home and your wife is angry with you as to where you have been whole day. if she's understanding and this thing.
Hmm.
And then of course I think there's a concept of holidays. So fortunately, in spite of working so hard in a government institution, we had this concept of summer
Summer,
vacations,
winter
and
vacations.
there
Yes.
is a provision for LTC, which
Hmm.
unfortunately I took only, I think, thrice in my entire lifetime. But then that doesn't have to be a rule for everyone, and I'm not trying to set an example or to glorify
Hmm.
it. But what I'm saying is, work-life balance is that it's all right for you to try to be an exceptional professional, but you can do it only if you are lucky and your family supports you. Otherwise, don't ruin your family life in order to just work on your professional goals. And when we talk about work life balance, we know that it's not just about work and family. It's also about finances, it's also about
Hmm.
spirituality, it's also about social, it's also about health. I think a lot of doctors, they do ignore their health also by long hours and not
Right.
spending enough time on fitness. And I think that's again, that's what my younger sister, who's also a doctor, says. Self care is not selfishness. You can't serve from an empty jug. So that is again something you have to understand. Like
Hmm.
what was in the monk who sold his Ferrari, he says, if you are on a highway and you don't stop for refueling because you will get delayed, you can't keep on going for very long. So I think in that perspective, work life balance is important, but life here is all encompassing your family life, your health, your spiritual aspect, all those.
So the next question comes from your fellow. I asked him, if you have to ask one question to professor, what will you ask? So he asked this: when he starts doing his surgeries independently, the knee replacements, what if something goes wrong? And so the question was कि आपके साथ भी कभी ऐसा हुआ होगा, the things are not going the way you want, या फिर आपने perfection नहीं दे पाए. So what to do in that case? How to face the consequences?
So one is that, try to prevent such a situation, plan well. But like you said, it's not
Hmm.
avoidable. But the if you have a plan B or plan C, it helps you bail out of the situation. But suppose it happens on the table, the first thing is ask for help. That's
Right.
number one. That's number one. So also about these life surgeries, my elder brother retired from the Air Force. So it starts with mentorship. So you train a person, then you go with him in at least that's what used to happen when he was training, in a twin control. It's just like learning
Hmm.
car driving, where you have another person who's got twin control. So he's also got a brake, and he's got all dual controls. I think training is very important, and that's what worries me many times about the standard of surgical training in our colleges. But then mentorship is a must. So one thing is that before you do independent surgery, you should have, so like in Air Force, they would say that you would have to have these many hours, with an instructor before you can go solo. And when you
Hmm.
go solo, you
Already know the
everything, and you
ins
go
and
over it
outs.
again and again. For
Hmm.
instance, even today, I would go over the steps of the surgery in my mind in a very complex case. So same way, if still something happens, first thing is ask for help, because the one who's there at the table, his judgment may be clouded, or he may be anxious, or he may be nervous. So first thing is ask for help. A person who's not directly involved in the surgery can come and take a very objective decision.
Hmm.
Life comes first, limb comes second. Whatever happens, you do that, and then you go and have a chat with the patient and the relatives at the end of the surgery to explain to them what happened and what to expect. And second thing is that it is often said that you should not be doing surgery if you don't know how to take care of your complications. A lot of people object to this statement, but I think this statement is very correct. Uh, I can't be operating, for instance, if I do knee replacement, and if it gets infected, I can't just be palming off those patients to somebody else, or just leave them in a lurch and let them find their own doctor somewhere who can take care of it. If I have operated, it's my moral, ethical responsibility to take care of it. And if I am not competent professionally to take care of a rare complication which has happened, which I have never faced before, I don't know how to do about it, I would still myself take the responsibility of seeking an opinion from a colleague who's more experienced in this, and ask him what should be done in this situation, and maybe even ask for help or refer to him after talking to him, and not let the patient go around and look for
Yeah, that
somebody
happens a
who
lot.
can
Right.
who can now treat his complication.
Sir, describe a day in your life in AIIMS, then today in Apollo, and also a typical Sunday for you.
So a day in AIMS varied as I grew. So we
Hmm.
always used to start work at 8 o'clock in the morning. So I'll only talk about my orthopedic career here. So I used to come as a day scholar. So I would start from my house those days at 7:30, because there was no traffic. Ring Road was free, and I
Hmm.
traveled say from 1986 as an ortho resident till 2023. The time changed, but traveling time was too less. So even by starting at 7:35, 7:40 on my scooter, I could reach on time. We would start the day either with the round or with the class, and then we'll either go to the theater or to the outpatient, and then we'll write. There were two units. Initially, there was only one unit. So the things were different. When we had two units, one unit would be in the theater, other one would be the outpatient. So every day will be either operation day or a pre-op and post-op day. So
Hmm.
you'll be looking after
Right.
previous day's surgeries, and you would be preparing for the next day's surgeries. Also, when the trauma center was not there, the duties used to be hell, because I remember there would be anything from 60 to 100, 110 injury cases in AIMS casualty, and there was no
Hmm.
trauma center. So we would be
Hmm.
just putting plaster, many times not given getting time to have dinner. The mess would be closed if you're in theater at the evening time. Then the trauma center came, the things relaxed a little bit. By that time, we were not residents anymore. And then come home. And so usually it would be something like working in the hospital from 8 to 8. When I became head, it started, I would start from home at 7, because I would like to reach and do some files. And then I became chief of trauma center. I would start at 6:30 or 6:15, because I would not like to compromise my clinical work, because I have to do administrative work, because you have to sign the files. So I would sign the files in the car while going. As a trauma center chief, I was entitled to staff card, so I would sign files on the way to hospital, on the way back from hospital. And then when the institute computers were hacked, so everything was computerized, so you could not get access from home. So I had to sit in the office and do all the files on computer. So that meant that even if I finished my operation theater at 10 in the night, I would go open the trauma center office and finish all the files, because it would always show how long the file has been lying with you.
Yeah.
Now, when I came, and but we could achieve a lot. Like, we had a record of earlier doing 19 surgeries in a day in
Hmm.
orthopedics, which we 19 joint replacements in a day. Then the next one was 22 in a day, and my last figure when I left was 25 joint replacements in a day. Incidentally, that day 33 surgeries were done in AIMS, because there were 5 major spine surgeries and 3 sports medicine surgeries. But the important thing was the augmentation of the infrastructure. I think if you have
Hmm.
7 operation theaters and you can't do 35 cases in a day, there is something wrong. So there are many rate limiting steps. So
Right.
doing 5 surgeries in one theater from 8 to 5:30 is not at all difficult. So you have to know how to make the system operational. There'll be roadblocks. People will tell you you
Hmm.
don't have staff. Oddly will say I can't so many theaters. The technician will say, I cannot run so many theaters. You have to have so many tourniquets. You have to have so many anesthesia machines. You have to have so many
Logistics,
tables.
right?
They should not be broken down. They should not be under
Hmm.
maintenance. You should be so. But all that is doable. There has to be a will to
And
do
sir,
it.
in Apollo,
Apollo is, although it is, it is, you see, it is the limitation of the number of beds and the limitations of the theaters does make one feel constrained. But then, obviously, when we came here, we thought that we would like to increase input, so we keep on trying to achieve more and more. So, whatever I am doing today, I hope to do it better 6 months or 1 year down the line, streamline the system. I have a colleague here in Apollo who says you have to understand the system to master the system. So we have understood the system, so we know that we can how we can increase productivity, patient outcomes, patient satisfaction. But then there are many things which are very good in Apollo. For example, the safety features, the JCA accreditation has made it possible. In fact, I often say that if I had visited Apollo before taking VRS, I would have improved many things in AIIMS. For example, at in Apollo, at every scrub station, we have the station for splashing, for splash ice splash,
right?
this thing. You can wash your eyes,
Hmm.
it's everywhere. And the timeout is done so stringently. even
Yeah.
the even
Even before
the
starting the
even the
surgery.
details on the x-ray, if there's a mismatch, the patient will not be taken inside. So
Right.
there are safety measures are very good. The other thing is, of course, for a joint replacement surgeon, the availability of physiotherapy and pain control round the clock. I mean, if
Hmm.
I finish a surgery at 10 and I want the patient to be made to walk at 12 o'clock in the night, it will be done. So there are, you have to actually see what advantages the new system has, and you have to see where you can contribute to improve the system from your experience from another institution. So each institution has its pluses and good things and not so good things. So we have to make good things better and not so good things good.
सर संडे नहीं बताया.
So a classical Sunday for me is really, if I really have to have a chutti, it starts with getting up a little late, like every
I
day.
don't believe you.
When we start, so late is 7 o'clock.
Yeah,
So
exactly.
otherwise, on most days, have to
Uh,
get up at 5. So get up at 7, and unlike the normal days, have 2-3 cups of
hmm.
tea, and read newspaper. I'm very fond of reading newspaper. Hardly get any time. I can just
Yeah.
skim through the headlines, and then I would like to watch some TV, watch some good movie, talk to my children, talk to my sister and my brother, and all. And uh, fortunately, unfortunately, my wife works 7 days a week. So then in the afternoon, when she late afternoon when she comes, we either visit one of the relatives, or we invite somebody
Hmm.
over and have some socializing in the evening, and that's how it ends. But actually, the problem with the Sundays is they just go away too
And it
fast.
leads to a Monday.
Always the Monday blues.
Yes. Sir, are you religious?
I am very religious, and I have good reasons for feeling the way I am. But then I always say religion is a very personal thing. So I am very religious, but I don't ask my wife to or my children to follow what I do. I just let it be with them, whether they want to go to temple or not, whether they want to keep a fast or not. I feel, to me, the religion gives me a great strength, and it also makes me do things which which I would otherwise not feel so confident about. It somehow gives me that inner strength. I was telling a patient yesterday, she said, I want to get operated in Navaratras. So I said, some of the most complex and most difficult surgeries in my life, including the first ever total SW allograft in India, was done by me in Navaratras. The first cup cage for a very complex revision was done in Navaratras. So for me, it's life is also about seeking the meaning of your existence. And I think I'm far away, not far away, I'm not even initiated in that, but I do hope that someday, if I ever get an answer to that, it will only be through spirituality and religion. And most of all, I think what it does is it tells you to accept many things as a will of a wish of God, and also sort of not try to ever harm anybody, or because that is something which is so that sometimes becomes very difficult as an administrator, because where you can't leave somebody without a deterrent action. But then you have to take it as your duty. So you say that you are not the one who's harming him, but he is actually getting what he sort of asked for or bargained for by his actions. But then I think to me it has proven to be really the roots came from my mother, who, when we were little children, we could barely walk. There was a temple about 10 houses away from a house. There should be no traffic on the road. So even as a 4-year or 5-year-old, I remember carrying a glass with milk and water to offer to a shivling in the temple there. So the roots are very strong, and you can't just shake off those roots, whatever happens in your life.
And another important question, what is your salary? What was your salary in AIIMS and what is your salary now?
So the salary at AIIMS and the salary here, both the times they were enough. Never felt this thing. My elder brother, he retired from Air Force, and he said, I'm never short of money, because the day I cannot do something because of lack of money, that day I'll feel that I'm not paid enough. Right. So my father was a government servant. My elder brother retired from Government of India as an Air Force officer. So he says, if some of my work cannot be completed for lack of money, that's the first time I'll say that I'm not being paid enough. Of course, when we talk about money here and money there, it's in multiples. But I don't think that money matters after a certain stage. And second thing is, it's just that doctors hardly ever get to really enjoy their money unless they are the ones who are physician and good
Right.
work-life balance,
Exactly.
and who have been in practice for very long. Otherwise,
Or generation of
as a government servant, vacation meant, maybe we should take LTC. At least we get free tickets.
right. Thank you so much, sir.
Thank you.
I think हर किसी को from students, young aspirants, patients, हम लोगों के लिए सबके लिए बहुत ही knowledgeable रहा, बहुत enlightening रहा. Thank you for sharing all the details. So guys, ये था आज का हमारा podcast with Professor Dr. राजेश मल्होत्रा. सर का नाम और ऑर्थोपेडिक्स, जैसा कि आप लोग जानते हैं और समझ ही गए होंगे, सिनोनिम्स हैं. हमारे लिए सर की एक एक बोली हुई बात एक लर्निंग एक्सपीरियंस है. सो आई होप आप सब लोगों को ये पसंद आया होगा. इफ़ यू लाइक्ड इट, प्लीज़ प्रेस द लाइक बटन. इसको आप शेयर करिए, सब्सक्राइब करिए. आपके जो मेडिकोज या नॉन मेडिको दोस्त हैं, जो पेशेंट्स हैं, उनके साथ इसको डिस्कस करिए. एंड इफ़ यू हैव एनी क्वेश्चंस, कुछ आप सर से पूछना चाहते हैं, कुछ हमारी टीम से पूछना चाहते हैं, यू कुड ऑलवेज राइट अस, या आप कमेंट्स में लिख सकते हैं. एंड इफ़ यू थिंक यू बिलोंग हेयर विद मी ऑन दिस पॉडकास्ट, आपने कुछ अलग से हटके किया है या आपने अपनी फील्ड में एक्सेल किया है एज अ डॉक्टर, तो प्लीज़ यू आर वेलकम, राइट टू अस. थैंक यू.